Hello and welcome. Today we're diving into something really important, a challenge that honestly most of us will face at some point: how to care for the dying.
So, let's just start with the big question, the one that really sets the stage for everything we're about to discuss. When a cure is just not on the table anymore, what's the most important thing? What really matters? It's a tough one, right? And it's a question we might have to answer for ourselves or for the people we love most.
Okay, to really get our heads around this, we're going to walk through a hypothetical case. Now, I want to be super clear. This isn't a real person's story. Think of it more as a way to understand a situation that, well, so many families find themselves in.
So here's the scenario. We have a 70-year-old man. He comes into the hospital with this really severe low back pain. And after all the tests, the diagnosis comes back, it's multiple myeloma, which is the type of cancer. It's affecting his spine and one of his ribs. The prognosis? It's tough. The doctors are saying he has a few months to live. And because of his age and just how advanced the cancer is, really aggressive treatment just isn't an option.
You know, a diagnosis like that, it's a huge turning point. It changes everything. And it forces this massive shift in how you think about the situation. Which brings us to our first big idea, the shift to caring. We're moving from fighting a disease to caring for a person. So let's look at what that shift really means. It's like you're choosing between two completely different paths. On the one hand, you've got curing. All the focus is on the disease. You're throwing aggressive treatments at it, fighting to save a life. And in that world, death can feel like a failure. But on the other hand, you have caring. And here, the whole focus flips. It's all about the person. The goal becomes comfort, well-being, and allowing a life to end with dignity. It's about accepting human limits.
And this quote right here, it just nails the whole idea. It's about a humble acceptance of human limitation and weakness. See, this isn't about giving up. Not at all. It's about a deep, humble acceptance that some things are just outside our control. And understanding that, that's wisdom. It's not failure.
Okay, so if we're on board with this shift in focus, how do we actually do it? How do we make these incredibly tough decisions? That brings us to our next part, the patient's voice and the principles that should guide us.
All right, here's the bedrock principle, the absolute foundation of all of this. The primary duty of caring for one's health belongs to the individual. What that really means is the patient or their proxy, someone they've chosen to speak for them, has to be at the center of everything. Their voice is the one that matters most, period.
Now, to make good decisions here, there's a key idea we need to wrap our heads around. It's called ethically extraordinary means. Sounds complicated, but it's not. Basically, it refers to any medical treatment that's either way too much of a burden for the patient or just doesn't offer much hope of actually working. It's a way of asking, is this really helping the person?
So who makes that call? Well, it's not just one person. It's a shared process. Step 1, the doctors. They bring their expertise to the table. They figure out the medical odds, the hope of success. Step 2, the patient or their proxy. They're the only ones who can truly say what the burden of that treatment feels like. The pain, the exhaustion, the effect on their quality of life. And step 3, this is absolutely crucial. You always provide basic comfort and care. That's the non-negotiable bottom line.
Okay, so we have the principles, but are there any practical tools that can actually help us with this? And that takes us right into our next section, tools for a final chapter. We're going to look at something called advanced directives.
You've probably heard of these before, right? Things like a living will or a healthcare power of attorney. These are what we call advanced directives, and they can be a really useful tool. They let a person lay out their wishes for medical care ahead of time, so their voice is still heard even if they can't speak for themselves. It can also be a big help for just preparing emotionally and practically.
But, and this is a huge but, these documents are not a magic bullet. They aren't a perfect solution. For one thing, a person's condition can change in ways nobody could have ever predicted, making a document from 5 years ago, well, maybe not so helpful. If they're too rigid, they can actually lead to care that feels inhumane. And here's the biggest thing. A piece of paper can never, ever replace a real conversation between human beings.
And that right there leads us straight to the main point, the absolute heart of what this is all about. We're talking about the one thing that you just can't replace.
So let's just put it out there. After all this, the principles, the tools, the challenges, what is the one single thing that no document, no procedure can ever substitute for?
It's actually pretty simple, but it's so powerful. It's constant and open communication.
And look, this isn't just a chat between two people. This essential conversation has to be a circle. It has to include the patient, always first. It has to include the family, and it has to include the healthcare team. Everybody has to be talking, and maybe even more importantly, everybody has to be listening all the time.
And that really brings us to our final question for you to think about. If this kind of constant communication is the real key to compassionate, dignified care at the end of someone's life, then the biggest question for all of us is this: how can we start having these vital conversations sooner?